Hi guys, Dr. Grosky here today. I'd like to talk to you about low-dose allergy therapy, or LDA. This is a therapy that we've used at the clinic for a number of years now. It's highly effective for the treatment of allergies, both environmental or seasonal, as well as food allergies. Let me tell you first how it compares to the other treatment options out there. There are three types of desensitization treatments that I'm aware of. There's conventional allergy therapy, which involves one going to see their allergist, having a skin prick test, and following that the antigens, or the things that you're allergic to, are identified, and a schedule of treatment is determined. That might involve one visit per week or once every second week, but it typically requires multiple visits per month on a very regular basis, and that is over the course of a year to 2 years to 3, depending on the severity of allergies. In short, it's very time consuming, and the downside of it is that testing is required beforehand. Very frequent visits are required. One needs to go to the office. A lot of people will have their family doctor do the injections because it's easier for them to access their family doctor's office versus the allergist, and so on. So while it can be very effective when done properly, there are certain shortcomings of conventional allergy therapy. Another form of treatment that's available is called sublingual or slit therapy, sublingual immunotherapy being the full name. And conventionally that's used more in the pediatric population or in kids. It's more convenient in being a sublingual drop. You take 1 to 2 drops per day. You can do it at home. You don't need to go to your doctor's office. And so in that way, it's way more convenient than typical conventional therapy. Where it falls short compared to conventional therapy is that it's weaker, and so the overall treatment ends up being longer in duration. And a lot of people also tend to stop doing it after the season during which they have their worst allergies. After it's over, they tend to stop and just fall off the bandwagon. That brings us to our last type of allergy therapy that we're going to talk about today, and that is what we do here in the clinic with our own patients. It's also what I've done with myself and my family. I myself had seasonal allergies, hay fever, animal allergies, dogs, cats, etc., and my son as well, dogs, cats, and it prevented us from having a family pet, much to everybody's disappointment. Now, fortunately, we do have a family dog, and that's going fantastic. The treatment we've been offering here at where we're at naturopathic for the last few years has been hugely successful. We've had a lot of great success with patients, and that's called low-dose allergy therapy, or LDA for short. This form of treatment does not require testing in the sense of we don't need to know specifically which things you're allergic to, either for the environmental allergies or for foods. The reason for that is there is either environmental mix that's used for environmental allergies or a food mix that's used for food allergies. And each of those mixes includes all of the antigens that one can be allergic to. So for the environmental mix, that would include a low dose of trees, all the various trees, alder, birch, etc. Grasses, all the various variations of grasses. For animal dander, it includes cats, dogs, a variety of other danders. And those that might not be included, there is enough cross-reactivity of the pollens and danders that are included that individuals with allergies to those antigens that aren't included still have an improvement. I've had children who live on farms who are allergic to many of the different animals that are found on the farm, and they have improved tremendously through the treatment. So first off, the LDA therapy does not involve testing because all of the antigens are included. And secondly, it's much more convenient in that it is an injection, However, it does not need to be done every week. It's done every 7 weeks. That's the typical schedule. If it's longer than 7 weeks, that's fine, so long as you try to get it within that same sort of time frame. For children, it doesn't need to be an injection. It can be sublingual. Preferably, we do an injection, but if a child is terrified of needles and it would prevent the child from getting any treatment, then we certainly would use the sublingual option instead. And that just involves the child having the droplet placed in their mouth, under their tongue, and holding it there for roughly 30 seconds so that it can be absorbed into the bloodstream. And it's been hugely effective. Hard to compare it to an injection, but patients have certainly improved greatly on using that form. Now, why is it as effective as a conventional shot if it's done only every 7 weeks? Well, what differentiates the two is that while you're using all the antigens on one part, it is very low dose. So how could a lower dose treatment work compared to a conventional allergy shot? The magic is in an additional ingredient that's added to the injection, which is beta-glucuronidase. And beta-glucuronidase is a immune modulator. It's an enzyme, and that enzyme stimulates the immune system or modulates the immune system to recognize everything that's included in the antigen mix as being safe. And so it signals to the immune system, you don't need to react to these antigens. And so as a result, a cell, the T helper cell, which is part of your immune system, is providing the immunity or the desensitization to these antigens. And so it's a developed desensitization or a developed immunity that one develops through the treatment. And these T helper cells have a 7-week time span or lifespan. For the most part, some are much longer lasting. And so the goal through treatment is to have enough T helper cells that are long lasting and circulating to provide the overall permanent immunity. Typical schedule would be every 7 weeks for the first year. One would have an injection or sublingual drop of either environmental mix and food and or food mix. And there's also a chemical mix, which I should add for people who are dealing with multiple chemical sensitivity. That is done after 6 treatments of the other environmental and food mix. And so the second year, the hope is that at that point, after about 6 treatments, majority of patients have had a tremendous improvement in their overall allergy symptoms, and the overall allergy load has been brought down. What that means is that majority of people would develop first environmental allergies or sensitivities, and then food allergies on top of that, and then some would also have chemical allergies. And so in bringing down environmental and food, reactions to other things would be much lessened and much less common. So the second year, one tries to go as long as possible between injections while they're asymptomatic. You might be going every 2 months, every 3 months, and already that schedule is reduced compared to conventional. Third year, you might be coming in maybe once or twice. So overall, after the first year, the overall end goal is just to come in as needed for a booster. Okay. Thank you again. It's been Dr. Groski at White Rock Naturopathic discussing low-dose allergy therapy and the benefits that we've had over the last number of years, both personally as well as with patients. If you're interested in this therapy, please contact our office.